Okay, let's go through the process. It's pretty simple. Once everybody has logged in, simply click and move forward as each page presents the information. One individual is the session leader. That individual reads and guides the group through discussion. Okay, today's lesson is going to be assertiveness. Assertiveness, the willingness and readiness to actively participate, state, and maintain a position until convinced by the facts the other options are better. Assertiveness requires initiative and the courage to act. Comfort level. Comfort level is the degree to which you feel comfortable in what is happening, while taking into account that flying a mission can be dangerous and demanding. Whenever comfort level is exceeded, speak up. That's the main point today. Just if your comfort level is exceeded, speak up. Okay, behavior. Passive assertiveness. Overly courteous, beats around the bush, avoids conflict, along for the ride. That's not what we want to see at all. Active involvement. Readiness to take action. Provide useful information. Makes suggestions. That is the definition of assertiveness. Over-aggressive. Domination, intimidation, abusive, hostile. Not acceptable in any professional environment, certainly not during medical transport. Okay, what are some barriers to assertiveness? Position of authority, experience, lack of confidence, fear of group opinion. So just be aware of barriers to assertiveness. Okay, the next step. We always go through a scenario. An air ambulance EMS helicopter is on a day mission to a PR event. As the pilot is making his final approach to the LZ, he sees a large power line above and to his left. Whoa! Did you see that? He asks the nurse in the left seat. She replies, yes, I'm sorry. I thought you saw the power lines. It's pretty obvious. The aircraft makes an uneventful landing into the LZ. Now we go into the section of points to ponder, some discussion, some engagement. What is a constructive way to debrief this flight? And this is where we go through a discussion of what we think would be appropriate. What should the nurse have said and when? What type of assertiveness is the nurse displaying? Well, let's think about that a second here. Was it passive? Was it active? Was it overly aggressive? And a lot of times this will be determined by how the scenario was actually read. Discuss it. See what your feelings are. See what your beliefs are. Pilot, share an example from your own past aviation experience of either effective or non-effective assertive behavior. We all have stories. This is the time to share them, but not too long. Keep it brief. Okay, clinical crew members or communication specialists, share an example from your own experience of somebody that's been effective or non-effective. Again, time to share some stories. You've all been through it, but just keep it brief. The idea here, again, is to engage, to discuss. All right, now we go to summary of effective action. The reason we have this is just to clarify what the appropriate behaviors are so that everybody's clear on that. Summary of effective action. What you don't see can kill you. The most challenging phase of any flight is landing into a non-airport obscure LZ. Lots of things can happen. Having a good lookout doctrine consists of sterile communications environment anytime the aircraft is making an approach to any LZ, even airport or hospital zones. Never assume the pilot sees any obstacle. The life you preserve will be your crew's. So speak up. That's the main point today. Speak up. Okay, let's proceed to knowledge verification. This is just a simple quiz. 3 questions to make sure everybody understands the key concepts. Question 1. The ideal time to make the pilot aware of a large power line would be when the main rotors make contact. B. Immediately upon seeing it in a calm delivery, noting location. C. To wait for him to make a statement first, even if you notice the power line. D. Only if it appears to be within 10 feet of the main or tail rotor. Well, that would be B. 2. When your comfort level is exceeded, you should A. Look for body language cues from others to try to determine if their comfort level seems to be exceeded. B. Remain quiet because you're probably overreacting. C. Speak up. C is the answer. That's the whole point for today's lesson. Which can be barriers to entry? Position of authority, experience, lack of confidence, fear of group opinion, all of the above? Well, that's E, all of the above. But let's hit C and see what happens. Submit responses. Oh, something didn't go through, so something was incorrect. All right, we know that that is E. Submit answers. and then you go to the end and you're all complete. Basically what happens is you have a positive message at the end, and that message is help each other. Basically in this field, we don't have an option. We don't have to love each other, but we don't have an option to not help each other. That's the whole point. And that's a simple lesson.